Can migraine affect children? A question was asked by one of my followers, and the answer to this question is yes. Migraine headaches can affect kids as young as 2 years old or even younger. Now, in general, migraine headaches are more common in females between age 17 to 40 because they're related to hormonal changes. However, it can affect kids. Migraine headaches can also present differently in kids. We have different types of migraine headaches in kids, like cyclic vomiting, where the child would present with periodic vomiting without the headache. Or they can have abdominal migraine, where the child will present with abdominal pain without headache. Typically, this makes it more difficult for the neurologist to confirm the diagnosis. Also, the headaches can present differently in children, or it still can present as adults. With the headache is a throbbing, moderately severe headache associated with sensitivity to light, sensitivity to noise, nausea, and vomiting. Now, it can go for years without being diagnosed because typically the family will not pay attention to it, and they say, well, just a headache. They can give him Tylenol and it goes away. Now, how do we diagnose it? The diagnosis is based on the clinical history and the physical examination. Typically, physical examination is normal. However, the clinical history, for us, we confirm the diagnosis based on the type of headache-associated symptoms. However, in general, we typically order an MRI of the brain to make sure that nothing else is going on with the child that might be causing the headaches, unless we're 100% sure that this is a typical migraine for the child. Now, how do we treat it? Now, it depends on the number of headaches, the severity of the headaches. Initially, we start with Tylenol or Acamol, or we start with acetaminophen or ibuprofen. Ibuprofen is more effective. However, we advise the family to give the medication immediately when the child complains of a headache. We also coordinate and educate the family to talk to the school, so the school nurse or the teacher knows that the child has a migraine and gives the medication immediately to the child when they complain of a headache, rather than wait until the child gets home. Now, if this does not work, then we go to the other medications like the triptans that are FDA approved for adults. However, we use it for kids like sumatriptan, Imitrex, or Zomig, or Bralpax at a lower dose. Now, if the headaches are frequent, then we go to prophylactic therapy or preventative therapy. We can use Topamax, we can use nortriptyline, amitriptyline. Those can be used to prevent the headaches if the headaches are more frequent or if the headaches are severe, interfering with the child's life. Now, the bottom line that kids can have headaches. They can be delayed diagnosis here because they can go for a while without being noticed. However, if your child complains of a headache, you should see a neurologist to get him checked out or get her checked out, because it could be a migraine or it could be something else that needs to be diagnosed and treated. Thank you.